This is another case. This is the MRV image, sagittal view, and this is the T2 weighted coronal image of the brain of a newborn baby. Here in the first image you can see that torcular hierophily is very high. You know that this torcular hierophily should be lower than the lambdoid suture. Here is the, at this site there should be a lambdoid suture, but here in this case you can see that torcular hierophily is going upward. Basically, torcular hierophily is a point where all the superior sagittal sinuses, straight sinuses, transverse sinuses unite to a single place. This is the torcular hierophily. This is, you can see, this is torcular hierophily. You can remember this word by tortuous because these venous sinuses are tortuosity in the vein, and you can remember by mnemonic tortuous to torculus. And you can also appreciate that the transverse sinuses are angled upward towards the torculus hierophily. And you can also appreciate that straight sinus is also angled upward to drain into the torculus hierophily. This is the normal picture of the MRV. You can appreciate that straight sinuses should be lower, angled in this way, angled downward towards the torculus hierophily, and transverse sinuses should also angle downward or straight towards the torculus hierophily. But here in this case you can see transverse sinuses and straight sinuses are both angled upward. Why these are angled upward? Because there is a large cyst in the posterior fossa. Here you can appreciate that this is a posterior fossa is filled by a fluid filled structure, and you can also appreciate this is the transverse sinus, right transverse sinus, and this is the left transverse sinus. These both sinuses unite toward a common point, that is the torculus hierophily. This is the torculus hierophily, and you can also appreciate on coronal images that these are angled upward. Torculus transverse sinuses are angled upward. This is the normal picture, okay, and this is an abnormal fetal persistent of the occipital venous sinuses. Okay, this is basically a case of dandy-Walker malformation in which there is a large posterior fossa cyst that has pushed the torculus hierophily upward, and this is called torcular hierophily lambdoid inversion, and there is a persistent of occipital venous sinuses. Occipital venous sinus. This is the persistent of the occipital lobe sinus. Okay. So this was a case of dandy-Walker malformation. Hopefully this will help you. Thank you very much.